Hello and welcome to this week's What Were They Thinking? This week we begin with news on China's successful control of the outbreak of the CCP virus, or at least supposed successful control of the outbreak. The second wave occurring in Beijing gives some question to that particular claim. The idea that Beijing has had to enter into wartime restrictions would make us think that perhaps they haven't been entirely honest. Officially, the claim is that about 100 cases have been diagnosed. That is 100 individuals, yet wartime restrictions have been mandated. Somehow, those two concepts do not mesh. This is probably the rather concerning second wave that has been anticipated both for China and in many other countries. Worse yet for China, it's occurring in Beijing, the political capital. This means that if leadership is infected, there's a good chance that China's ability to respond will be greatly impacted. It's important to be aware of the fact that China is a top-down approach to any problem. Leadership will give instruction from Beijing, which is then taken to a regional government and then local government. Each time, they are trying to enforce the decisions made from Beijing. This often creates a degree of anxiety about reporting failures back up the food chain, and one reason why, at least from Beijing's perspective, the CCP virus was able to get as far as it did before they started to take measure. The outbreak itself really isn't that surprising given how difficult the CCP virus has been to contain. The problem is, the CCP itself is making claims about where it has come from. There were a few theories put forward, one of which was contaminated salmon imported from other countries. Another is that a super spreader is infecting people at that market. We do know that the CCP virus can only infect mammals with the ACE2 receptor. Salmon do not have this, and therefore that theory is impossible. The super spreader theory, on the other hand, is viable, if only we had more information from China on what is happening. While still on the topic of the CCP virus, we should mention a study that's being published. It describes how flushing a toilet could lead to viral particles being put into the air, where they can remain for a time. Thankfully, it looks like it might only be a few short minutes. But even then, this is another vector by which the virus can be spread. This was done using computational dynamics. They are able to model the movement of fluids within the toilet bowl and see how they can come out and what potential danger that might have. This gives you cause to ensure that you remember to wash your hands thoroughly after you've used the toilet. If for no other reason than it removes at least one vector by which you could further transmit both the CCP virus and any other disease. Next we have some interesting fallout from the investigation of hydroxychloroquine. The fundamental issue is that a large amount of this drug was either stockpiled or donated to America in an effort to try and treat people. This was met with some degree of agreement from the FDA. The FDA had approved hydroxychloroquine and chloroquine for use with COVID-19 patients. The problem with this is that they've just revoked that approval about a week ago. This means that America now has a massive amount of this drug, 66 million antimalarial pills apparently, that can no longer be used for their original intended purpose, that being treatment of the CCP virus. This doesn't mean they don't have some sort of application, just not the one for which they were imported. That 66 million number is on top of another 31 million that has already been distributed at a state level. That means 2/3 of the national stockpile are sitting in storage and unlikely to be used at this point in time. Understand that America doesn't have a massive issue with malaria. In fact, arguably, they don't have an issue with it at all. There are certain areas where you might get a breakout every now and then, but overall, they are not going to need that much of the medication. The response from Trump has been predictable, but relatively harmless in claiming that it did him no harm. The issue is, the FDA pulled approval for use of it with the CCP virus because it can cause heart issues. Therefore, while it may not have done Trump any harm, it could well have done someone else harm if they had taken it under the same circumstances. While one drug is in excess supply, American hospitals are facing a shortage of opioids, another drug. It's been a long-running issue that many American hospitals have been unable to get an adequate supply of injectable opioids. This owes to a variety of issues, but overall it has led to a simple problem. Hospitals could not get enough of injectable drugs, while they could source things like patches and opioid pills. This means that hospitals could not inject painkillers into patients who were not conscious or who could indicate to what degree they needed pain relief, such as those on ventilators. Now with the CCP virus, this problem has been exacerbated. The article on which we're basing this video claims that much of the shortage that is being experienced at present owes to the combination of the low profit margin on injectable opioids versus those that can be prescribed. This is then made worse by the difficulty in the logistics of providing injectable opioids. They are needed to be transported in bulk in a safe, reliable format. Then they need to be stored effectively and then used. Given that it's a biologically active compound, once you begin putting it into an environment where it can't be safely stored, you can develop contaminants, denature the product, and other events that ultimately make it useless. This means that opioids by themselves need to be carefully looked after from manufacturer to use. The Reuters article provides a lot more detail and is really worth a read to understand what problem is being faced with this particular shortage of medication. Next we have what can only be thought of as a bizarre and rather impressive piece of anti-vax propaganda. It's an article called Why Forced Vaccination is Rape. Yeah, the subtitle does not help. A biological and legal systems analysis with options for recourse. They begin with their summary, and it is simply this: forced vaccination is rape. Now, we don't know how they get vaccinated, or if they're even seeing an actual doctor when they do get vaccinated, but it seems unlikely that what they're claiming is even remotely substantially true. We've provided a full breakdown of what we have access to thanks to the Real Truther for providing it on Twitter, and you can read it for yourself if you aren't so inclined. But overall, the process of being vaccinated, that is, a small injection with a small quantity of the vaccine into your skin, generally the upper arm or buttocks, does never involve any kind of forced penetration without consent. That is a big no-no in medical circles. Without telling someone you are vaccinating them and then doing it, or injecting any kind of medication for that matter, is a form of assault in general, and doctors don't do that. Forced vaccination is a non-issue at present given that it's not yet occurred. There is yet to be a situation in which a government has mandated that you must be vaccinated. Governments have previously offered options of either be vaccinated or incur a penalty. This often comes in the form of either a fine or lack of access to certain public resources. This is because those public resources would facilitate the spread of the disease that the vaccine prevents. Therefore, refusing to be vaccinated diminishes the effectiveness and possibly causes harm to others through a public service, such as schools. While we are still in India, let's look at a case study that's proving to be very interesting. It's about an 11-year-old girl who cries blood. The condition is known as hemolacria, and it has in this particular instance involved the young girl having blood streaming down over her cheeks for several minutes, several times each day. This occurs without pain or emotion. This means she's neither in discomfort nor crying. The bizarre thing here is that there's no history of trauma or other reasons why she would be having this particular phenomena. She doesn't have a blood clotting disorder, the blood pressure is not unusually high, nor are there any other reasons why her tear ducts should be filled with blood. The downside to this case study is that although they were able to give the child a diagnosis of what it is she has, they cannot explain why, which is why it remains idiopathic hemolacria. Next we have some technologically related news, and it's a bizarre AI program. It's a program that you can give a pixelated face to, one where there are no discernible features, and it will produce a viable human face from it. Not the original face, mind you. This is not a program that unpixelates a pixelated image, but rather it creates a new face from the conglomeration and rough approximation of all the shapes and colors that it sees. It then goes and adds features such as eyelashes and wrinkles. It does this by trying to work backwards. It takes what it believes to be the full and original resolution photo, then it attempts to blur it and figure out what image would have been blurred to create the blurred image it was basing everything on originally. The final piece of news we have regards biology, and particularly fertility. It's the idea that ovum might have a predilection towards certain sperm over others, and that this might in fact have an effect on the ability to have progeny. The study comes from the universities of Stockholm and Manchester. What they did was to take sperm and follicular fluid from 60 couples undergoing reproductive treatments. They were trying to figure out whether or not the sperm would be attracted or repelled by the follicular fluid. We well understand that in general terms, there is some sort of chemoattractant present during reproduction which draws the sperm into the egg. This is part of that selection for the strongest, fastest sperm, in theory. They then put all this together and tried to test whether or not the sperm would move towards it, note it at all, or not move. They found that different females would consistently and differentially attract sperm from specific males by comparison. As was noted by one of the zoologists involved in this study, for eggs and women there are a lot of extra costs that come after fertilization, such as the costs of pregnancy. Because of those costs, eggs should be choosy about which sperm fertilize them. This statement was made in regards to the idea that instead of the ovum, it might be the sperm that are attempting to be picky. That statement, along with evidence from other species, known as cryptic female choice, makes clear that it's likely to be the female in this case who's exhibiting behaviors and phenotypes that correspond to a more fussy choice about how and when they reproduce, and then with whom. At a basic level, this information's not as useful at the moment as you might think. The experimental settings were very unnatural, and as a consequence, there's a good chance that what we're seeing in this does not directly extrapolate to real-world cases. Further research might be a powerful tool in understanding why some people, despite having viable sperm and ovum, cannot reproduce, even with reproductive treatments. And this particular knowledge could be useful in understanding that element and how best to solve it. That is all the news we have for you this week. Thank you for watching, and if you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.